Good evening. Good evening. Should we give people another 1 minute to join us?
I think it would be great to give because I understand.
Thank you. Can you hear me?
I can. Can you hear me?
Hello.
Can everyone hear me?
Can anyone hear me? Sorry. Was I just talking to myself?
Tammy, we can hear you.
Oh, great. Excellent.
And thank you very much, Esther, for signifying that you could also hear me. Good evening once again, and good evening, Judith. Thank you very much for signifying that you could hear us. Thank you so much for joining us this evening. Thank you very much, Janet, and you are welcome to another time again where we're having conversation as pharmacists within the community health services. And this is just, we started this podcast, or should I say session, last month, and we thought that was very useful to raise awareness about community health services. My name is Jenko. I am the head of medicines management within my organization, Medway Community Health Care. And I've got my colleague here, Temi, and I'm sure she will be introducing herself. And I'm just going to do a quick recap, and I would acknowledge everyone that's joined so far. Last month, we did a brief introduction about community health services, what we do as a pharmacist, but community health services more in detail with regards to what community health services means, the various services that we do offer. And we had so many references that everyone could sort of have access to which, you could also refer to. We do have the common document that we tend to use in-house, which is the RPS Professional Standards for Hospital Pharmacists. But also, you also know that the NHS Confederation gives enough information about community health services, what it's all about. Last month, we also had one of the listeners wanting to know the innovation behind, innovative ideas within community health services. And we thought, why not? Why not weave that conversation into that awareness and raising more information about what we do, why we do, and how it helps us within the community health services. And we are not going to... We're not going to shy away from the fact that there might be challenges that we encounter, but rather we are going to own on what we could do differently, what the benefits are, and how we overcome certain challenges that we've been able to face. So as a head of medicines management, there are so many roles and so many hats that we have to wear, and it's very interesting at times, and I'm really happy to be actually here today to share with you innovative ideas, but also I also think it's a very important platform for you to also share whatever innovative ideas you have or you've encountered within your various organizations. And please don't think this is just pharmacy, because last month we had a non-pharmacist in our midst, and the individual was very, very active and wanting to know more. So this is not just a platform for pharmacists alone. So we're also aware that various individuals could tap into the resources that we've got here. So good evening to Janet. Thank you very much for joining us. Thank you, Esther, Ifoma, Kelvin. Thank you very much, Judith. We've got Lydia in our midst, Maria, Betha, and I think recently I've just had Tony Isaac join us. So thank you so much, everyone, for joining us once again this month. And we're just going to dive in. So because we know time is precious to you and I, and we just want to go straight into the conversations for today. So the focus today, it's about innovation in community health services. And you might ask, what is innovation? And that's probably a good start to kickstart our conversation this very evening. when we talk about innovation in community health services. So, I mean, I'm happy for people to join up the stream, to raise up their hands if they want to talk, and maybe just giving us some few, should I say, home rules. This platform, we acknowledge that we are all professionals, and if you have to give examples, it's by all means you can give examples, but it is not a platform to defame any form of organization per se, but we're using it to enhance our skills, raise that awareness, and also educate each other in that sense. So in all means, we are saying it's a professional platform, but it's also a platform for us to learn and to share ideas, and also to, should I say, an avenue for us to sort of meet new people as well. So I think that's key. I don't know if Tammy, are you there? Can you hear me?
Yes, I can hear you.
Fabulous. I'll hand it over to you. And I think this is, I'm talking about what is innovation. And I'm happy for people to raise up their hands, and you'll be brought onto the platform to have a discussion about what innovation really means to you. And we'll sort of delve deeper into what innovation has been for us in real life, and to see what other ideas you have there that we could also be able to tap into as well. Tammy.
Thank you, Janko. I think it's about, the topic is actually raised by one of the audience last week. And one of the things that I'm passionate about is to actually find out when we talk about innovation, what comes to mind? What do you think about when you think about innovation? Obviously, we're going to give you an example of innovative stuff that we've done. But it's important that we actually see what people see as innovation. And you can give an example of innovation that you've done. Nothing is too small, nothing is too big. Everything is can be discussed. So, and I think it's important to start from that place. So please do raise up your hand. Obviously, to tell us what innovation. Great, excellent. Janky, are you able to bring
Yes.
Judith up? Fabulous, excellent. We'll start with Judith.
Oh, that's okay. Judith, just keep your hands raised, and I'll probably be able to bring you up to the platform. Oh, that's interesting. It's not giving me the opportunity to do so. Mr. Calvin, can you please help me?
No, it's come. I've done it. It should have done it.
Okay,
yes, it's done it. Yeah.
Perfect. Hi, Judith.
Hi, Jen and Temi and the audience. My understanding of innovation is you being able to bring your idea to life. Like if you've been having that dream of starting something, when you start it and start putting your energies into it and making sure that it works and it impacts lives, that's what I think innovation is. Currently, I joined this audio event purposely to learn because it intrigued me when I saw the title Innovation in Community Health Service. I'm not a health practitioner, but I had an experience in my life to do with infertility, and when I managed to navigate it and finally got my success story, I felt like there is this dire need for me to help women who are out there navigate this situation through creating awareness around infertility and how they can seek help in terms of therapy for those who are going through a season of mental health crisis, and then in terms of health, to connect them to the different doctors that can be able to help in such kinds of situation. Because I believe in the workspace there are so many people. This doesn't only affect women, it also affects men. So I believe in the workspace we are highly stressed, and stress is one of the biggest cause of infertility, if we all know that. I felt there is a big need for, I saw a gap in that, and me coming out to preach about it and do something about it, I feel like that is innovative in a way. Thank you.
Thank you very much, Judith. It's amazing what you've just said, and you've sort of rounded everything about innovation. I'm just going to pick a few things you're going to say, and we're probably going to give Esther and Maria a chance to speak as well. I'm listening to you, and I'm hearing that, you're bringing new ideas about. You found out that there's a problem out there, problem about, infertility, raising that awareness, educating women, and also bridging the gap between individuals and healthcare professionals so that they can have that, they can have treatment, or probably even raise that awareness, or probably learn from whatever, infertility, or learn more about, ways to sort of get treatment, and or ways to identify, if they have any problems. And it's a great thing you're doing out there. I just want to say thank you and well done. But yes, that's a form of innovation. Thank you so much. Esther.
Yeah, so just to pick it up from, good evening, everybody, from what Judith has just said. Innovation, I'll describe it as something that you can build on, that you can develop on. So I will relate to some of what I do, especially on LinkedIn, and I'll relate it to health this time around. When I see write-ups and about health, and looking at what Sister Temi does, I tend to engage more in health. Whatever relates to health, I write on this. I tend to tag it. I tend to repost it. So this way, I tend to develop more, those ideas of engaging more in those areas that could help other people to learn more about it. So I just put little things just to catch the attention of people on LinkedIn, and then people tag along. So yeah, so that's my contribution.
Thank you very much, Esther. And just to echo what you're saying, is that echoing that message out there. You've seen the need to pick up on messages or pick up on information and redistribute it. I think that's one area that probably needs more build up on in certain areas. And looking on to what Judith rightly said, she's identified an area in infertility. I know we're talking about community health services, but there are other services, there are other organizations that deal with different different needs out in the community. Is looking at how do we tap those information, and that's it. You are dealing with those problems, and that's good. So thank you so much, Esther, for contributing.
Okay.
Maria Staines, thank you very much for joining us. You can unmute yourself.
Oh, hello. Thank you. So yeah, I'm a pharmacist working in NHS Kent and Medway. Innovation to me, I guess, is thinking about a problem and identifying a new solution, unique solution, something a bit different, something a bit more imaginative than what would have been the standard response to that problem in the past. And thinking, perhaps we've tried several things. We need to be a bit more innovative, use our imaginations, and perhaps try out some new ways of working, new ways of tackling something. And thinking about where I've been innovative, I don't know. I'm struggling to think of an example personally, but I've heard of some great solutions. For example, patients who have your typical patients that are really difficult to reach in the community, that you really want to be able to check up on their health and make sure they've got access to the services that you want them to have. We've got a bus, for example, in Kent and Medway, health and wellbeing bus that travels around different areas, offering services like blood pressure checks and vaccinations and different healthcare services to actually go out to people in the population to offer that service at the where people are in the communities. And I've heard of services going out and training like hairdressers and barbers and things about healthcare related issues, and taking services to where the population is in their everyday life. So it's a sort of an innovative way of reaching people that who otherwise perhaps in healthcare. So that's just some examples that I've heard of that I'm really impressed by, and
thank you so much, Maria. And you know what, when you said that
pilots can be proven to be successful and expanded.
Fabulous. Thank you. Thank you so much, Maria. It's lovely to have you on board. When you talked about the Kent and Medway health check bus, and you know what, the first time I heard about that was on the radio, and I was like, oh my God, this is amazing, because it reaches out to the population out there, people that are unable to access certain healthcare systems because they're probably busy, or in terms of proximity, they might have different excuses. So yes, there are so many innovative ideas that are being implemented within healthcare system. There's so many innovative ideas that individuals also have to help whatever this problem is. And it's important for us to know that innovation is a process. It's a process of bringing new ideas. It could be ideas, it could be new ideas, methods, it could be even new products, it could be new services, or it could be the solution to a problem that you've probably identified, and that this will make an impact or add value to that, to the population or to the target audience. It involves in transforming creative concepts. So, which means, like you said, having those bosses, healthcare, bosses that will go out there doing health checks, or it could be, like Esther rightfully said, reposting our information so it can meet, other urgencies that she probably has exposure to. Or it could be in form of Judith actually thinking, I've noticed that there are some individuals that, it might be in with regards to infertility. What can we do differently to be able to meet those needs? And that's what innovation is all about. One thing we've also, I've probably, when I was thinking about innovation, just like you, Maria, I first thought about it and I thought, oh my God, I probably don't know much. I probably don't do much about innovation. But after talking about different things that have been done within the organization, we ended up realizing that there are plethora of innovative ideas that have been implemented or are still incubating at the moment. And it's quite exciting. It's being able to see that there is a problem or there is an area for improvement, and being able to tap into what can we do differently. So, Tammy, we are going to go ahead and talk about the fact that, I believe, and I say this, that I believe that innovation is not, shouldn't be something big. When you think about innovation, it might just be a tweak in the idea. It might be a little tweak in the concept or process in what you're trying to do. And when we think about community health services, how we tend to bridge that gap, it might be in little things that we've done. And we're going to just talk about different examples of what we've done. And please, by any means, if anyone wants to talk, just raise up your hands and you'll be brought into the platform. I want to use this opportunity to welcome Angela Wale, Imo, and Abimbola, thank you so much for joining this platform. We are talking this evening about innovation in community health services, and we've had some of our guests talk about the experience in innovation. So I would encourage you to speak if you wish to. If not, you can use the comment section on the page to leave comments as well. Tammy.
Thank you so much about that. I will hand over to you in a minute, but what I wanted to just mention is that I'm so glad that some people mention little innovation, that it looks little, but it makes a big change. And the other thing is, innovation can be something that happen because it's an experience that you don't want somebody else to have. Innovation can be something that you want a better service, maybe because your relative have been impacted, and being on this call, I would say, is an innovation because I was when we were on the call just now, I was literally just thinking about it because the whole of this LinkedIn audio event actually happened as a result of me and Denko literally whinging about the fact that community health service have no voice and somebody needs to give a voice. And we decided that, well, if nobody is talking, we'll talk, and hopefully somebody will eventually hear us. In terms of that. And innovation can be a newsletter. You're letting people know about certain things that is happening that maybe a lot of people don't know about. And you just thought, I'm sure it's happening because I've asked 5 or 6 people and they said it's happening. So it must be a general thing. So thank you said, we're going to be talking about different innovative ideas. Can I get you to take the first point? Thank you, and I'll add to it.
I wanted to just add to what Tammy was saying, because when we first think about innovation, sometimes we could get lost in trying to find out innovative ideas. And I'm very pleased that some of our guests have sort of raised up, ways that they've been innovative in their own rights. And it's just to demystify that sort of concept that innovation has to be a big idea. So although we recognize that not all ideas are equal, so there might be some ideas that might sound tangible, but it's just thinking about it. What do we think the end result should be? What impact do you need to change? One of the I would refer to the NHS England post about why innovation is important in NHS. It says innovation is important in NHS because it's purposeful and it addresses real world challenges and prioritizes on facing challenges that are being faced within the society. So it's like any little thing that you think about you find your problem and you think, in what ways can we do differently? So I believe that's innovation. And I believe, I'm not trying to promote Tesco here, but I'm saying that every little thing, every little idea you and I have contributes to us having a better society out there. And that's key. Never discount your solution, your idea as a little idea. Think about it. Think about, okay, I've got this idea, no matter how big, no matter how outrageous it may be, what can I do about it? Who can I get on board? Like Tammy rightfully said, this podcast, for example, it started off as we two community health services pharmacists. Yes, we are head of medicines management within our organization. Yes, we are actually peer reviewers. We tend to review ourselves, and our organizations do agree that we do have this sort of peer support that we give to each other based on the nature of work we do, but also thinking about how we build upon the different innovative ideas we bring to plate within our organizations. So one of the points I'm going to raise, and and there are various points, so please don't feel like I'm the only one that's going to be talking tonight. So I am willing for everyone to bring up, whatever it is on board, and we can be able to say what you've been doing within your various organizations. Within the community health services, and as you know, we are not particularly we're not PCN, primary care network, and we're not completely acute, but we all work together because it's all about focusing on our patients. One of the areas that we've sort of honed on from a innovation point of view, it's about remote consultation. I say this because it has been big on remote consultation since COVID, and I'm sure every organization will probably echo that with me, because having had the whole COVID crisis, and when we had COVID in 2020, or should I say from 2019, it was more predominant in 2020. It meant that we needed to change the ways we were working, and remote consultation became the in thing. It was out there before that, but because it became the in thing because oftentimes you and I were not unable to access face-to-face consultation, so which meant there had to be more investment being made into remote consultations. So that's one of the significant consultations or innovations that I could think about from a remote consultation point of view, where I say from my organization, for example, we had individuals or clinicians able to have access to have consultations with their patients and, virtually, and be able to sort of prescribe, if need be, or rather refer to the right services via this remote consultation. So which means that it provided a more accessible and convenient access to healthcare for our patients, and it was also very timely, so we weren't having so many waiting times, and it was meeting the needs. So yes, we had that sort of increased need during COVID, but it has come to stay. And now within my organization, we do have the e-consult, where we are having those certain clinicians or certain part of the service able to take on some caseloads from the PCN and supporting those individuals and ensuring that our patients have access to the right healthcare at that point in time. And through this, we know that we've got access, those patients have access to prescribers, non-medical prescribers. They've got access to having individuals providing them counsel when need to. And if there's a need for them to have referral, they have access to have referral into the relevant services, which means you didn't have to wait 2-3 weeks to be able to do a face-to-face, but you can obviously avert that by doing a remote consult. That is an innovation as it is. You and I might think, but we've been into this, but that started from an idea. It started from a problem as well. It started from someone thinking, actually, we could do this. We could do our consultation differently. And if you could think about it, it also fudges how policies and how guidelines have changed to reflect on that. Fab. Judith, did you want to say something?
Oh no, I was just commending you for the ideas that you're putting across. I'm so used to people like when we are having audio events, people keep putting emojis to show that they're on the same page. That's
perfect. I like the emoji, so please carry on. That's fantastic. So the remote consultation for us had been very, very useful. We've had a lot of patients found it very useful because then they can easily have access. By all means, it does not take the place of the face-to-face consultations, but it also means that we have, individuals or patients out there that can easily have their, health needs being met without having to wait too long. There is a place for face-to-face, but also there is a place for the remote consultations. So this is also to ensure that there's continuity of care for those patients. And I think, in the world that we're in healthcare, we have to be thinking of ways of involving, and community health services also has to work in that line. So we're not working outside it. So just the way you would have, I would probably use my personal experience as an example. Being a patient as well in acute, I also have access to, remote consultations with consultants, which makes it a lot easier. I'm a very busy human being, and I'm able to sort of tap into that resource and get my consultation notes, get all the access that I needed at that point in time. And you could think about it, that's the way to go. I think that a remote consultation has come to stay. So community health services has also tapped into that, and we're also trying to improve on that by the softwares, the technologies that we're using to sort of help that process along. Another thing that I'd like to say, and I wouldn't mind Temi jumping on if so I'm not doing all the talking, because I'm sure you wouldn't mind hearing my voice, but I wanted to be...
Whenever you're ready.
I had to have something to say as well. Temi, go ahead.
I think with remote consultation is quite important, especially with community health services. One of the interesting thing about us is that we've got sites everywhere. So the service might be, the headquarters might be in one place, but the services are scattered because they cover a whole area. So they might cover Kent, or like myself, we cover the whole of East Surrey. And so how do we consult with healthcare professional when we want to discuss, for instance, talking about MDT? Now we can actually use that remote consultation as part of the MDT, which means, number one, we don't have to travel. The other thing is that we can actually invite the patient if we want to do best interest meetings and things like that. The other thing is that with the innovation, with the remote consultation, we've been able to, one of the things I had to do with my nurses as the non-medical prescriber lead is to ensure their prescribing and everything is up to date and in line, and their scope is in line and everything as they join that remote consultation. And we have to look at their competency documents, that they actually understand the standard, confidentiality when it comes to patient prescribing during their remote consultation. So it's been a game changer really when it comes to medicine. And we've been able to do that by the power of obviously technology, which is why you and I can be in a room, which is virtual, but we can obviously learn from each other today. Great, thank you. Janky, do you want me to move on to the next one?
You can.
Okay, so we're talking, the next example we were talking about is about data. In terms of how do we, innovation that I've done is around data, and I'll get obviously Jenkyo to talk about that as well within our service. So within my service, one of the things I have to do is to document interventions and the piece of work that we do on the ward and in different services within the organization. And what used to happen is that I used to use an Excel sheet basically. So one of the days I suddenly have the word and the fancy chat and everything. And I was like, where did you get that from? And they were like, oh, we just sent some data to the IT, and IT put it in some software and it just produced the data for us. So I was like, oh, interesting. So, okay. So I linked up with my IT and I said to them, I have this data and I've seen what you've done with the word, and I want to do something like that. So they use a system, or people who have heard of it, is called Power BI, Power Business Intelligence, I believe it is. So you can put data in it, and you can continually put data in it, and it will draw the graph. It will do everything for you. You can continually put a data on it, and so you can look back for 2 years data, 3 years data. That way, I'm able to, if somebody is asking for, like, if I have CQC visit and they want data in real time, I can actually log onto that system and actually bring about that data. And that really helps me as well, because one of the things maybe we've not touched on within community health services, that community health service, the teams within community health service are quite small. So you have a lot going. So how can you actually look at how other teams within the organization can help you, and that can be innovation. Is there something you're doing now that you can actually ask your IT team how they can help you to do it maybe quicker, and you can actually buy back some time? So that is one thing that I've done within my work that has really helped me and transformed and given me back some time so that I can actually allocate those time to other tasks that I've got. I'll let Jennifer comment about the data side of things and how she's used it within our organization.
Thank you very much, Tammy. I think it's important to understand that data analytics, it's very key for whatever we do within the healthcare system or any form of organization. Gathering that data, having those analytics information, it's key. So harnessing the power of data analytics and predictive modeling, it gives us valuable insights to what we are trying to see. So like medication trends, you could actually see some patterns or outcomes within the community. So within MCH, for example, I look at data analytics. I use it to probably identify training trends within a particular area within our organization. So I can then focus on what areas I need to train individuals on. Another area that we use Power BI, just like Tammy rightfully said, we've been able to identify using Power BI to identify how some of our services have been able to have been focusing on certain services. So I would give an example. We had an issue when we were trying to work with our commissioning board, for example, within Kent and Medway, and we were talking about formulary changes, and within our services we needed to give them data of how many patients we were seeing for a particular service. And it was very interesting to be able to, because obviously it was medicines related as well, it was important for me to know if it was a viable need for us to know if we're changing the formulary to influence that population, or we are just going to go with the flow. And I'm not saying just go with the flow with that sense, it's having that evidence. So the data analysis, we're able to identify the patients that we're seeing, what sort of dressings or what sort of medications they were using at that point in time, and working with, and I'm sure in the last podcast we were able to say, I was very fortunate to say that I do work within a ICB that it seems like a closed niche because they're willing to support. So having that data, communicating with them and seeing how we influence the population was very useful on what sort of, what would be effective for that population at that point in time. So that's why we've been be able to use data analytics. We've also been able to use our data analytics in our incident reporting. For example, we've had a new incident reporting system being implemented, and as the medicines lead, as you would say, it's important for me to know the trends of incidents that are happening, and those are the key things that I requested for, that I wanted to be able to see. That I wanted to be able to see key areas that we are having more increase in incidents and knowing how to deal with those issues, or even influence our standard operating process so it can be more robust, so that our staffs on ground are able to work effectively and provide a better service to our patients. So I feel like data analytics is very good, and I'm sure anyone everywhere will be able to say, actually, you have to use the data to be able to influence change as well. So those are one of the examples that we've been able to in using the data to be able to influence how medicines or medicines management works within community health services. So I think that's been key for us. There are other areas in terms of data analytics, and I'm sure in your various organizations, you would probably be able to give examples. So I would welcome anyone that wants to sort of speak to come up and just raise up their hands in terms of how they've been able to use data analytics to sort of influence their, in terms of innovation or innovative working within their organization or within the service. That would be great. If not, I'm just going to move on to the next point for me. The next point for me would be focusing on collaboration. I think, anyone that is not thinking about innovation and putting collaboration together will be missing a key ingredient when it comes to innovation. One of the things that Timmy rightfully said is identifying who to work with, because it'll be difficult for you to have an idea and think you're just going to be the sole runner of that idea within community health services, especially when the issues around capacity might be, an ongoing thing. Within community health services, we identified last month that it's a small team. And we are not using it as a negative, but we would spin it around to for our own benefit, is thinking about what resources have I got out there and how can I tap into those resources to ensure that my innovative idea works. So I give an example. This is an ongoing process, so I am going to be, I think in the next couple of months, I'll be proud to say, yes, we've been able to sort of implement it and it's working. So it's still going through some technical phases at the moment. So we've been able to work collaboratively with our acute to, form a shared drug chart, in the sense that it can then be moved from one care setting to the other without infringing into patient safety. How did we come up with that idea? So what happened is we had one of our services break from the acute, come into the community so that patients could have better access into that service. But one thing we knew that was difficult was that medication administration section. And that's because those patients that were out in the community would often go out back into the acute trust. And not having that sort of continuity in their medication administration meant that both sides, both organizations were not seeing the full picture. A, it could mean that they're having to do photocopy, or B, it means that they're having to take, document both ends, and there's a potential for breaking communication. So the innovative idea is, why not we create a document that could transfer with the patient when the patient goes in and out of the care? And that's working well, because we've been able to start that implementation process. It's gone through governance. And I am going to say, I'm going to be pleased in the next couple of months when our patient, we see the first patient, because it's not very common to see that for that particular service, a lot of patients influx, but I'll be very glad to say that actually we've had this amount of patients go through that process without having any sort of issues. And the issues we were having also was to do with, nurses or individuals transcribing, or also even involving the pharmacy team, where they would have to screen the chart. So we had to put everyone into this. So you might think, okay, I'm just the only pharmacist or the only pharmacy individual within the team, but I was able to work with the acute pharmacist, the, various individuals within the different organizations to make sure this works. And that's, for me, is collaboration. Also, another example that I'd like to give, and I'm really proud of it, and I feel like I'm in a very fortunate patch or healthcare partnership where within, from a medicine's point of view, we like to sing on the same hymn sheet. Having, one of the issues or challenges we discussed last month is that within the community health services, it's like workforce is quite limited. So I've been able to get the support of the acute to have interface pharmacists between acute and community health services, whereby those pharmacists can work between both sides and get the knowledge of community health services, and also be able to deal with any sort of discharge issues that we might have within both, within CHS, community health services, or the acute services. And this is you think about it, this is what we want. We don't want any break in communication. We don't want break in patients' medications. We want a seamless transfer of care. And having a pharmacist to be able to do that seamless care, it's absolutely amazing. I'm vouching for it. So if you are out there and you're thinking, is this going to be possible? I am saying this is possible as long as you're willing to sell it right. So we have been able to have that sort of interface working, and I'm sure the chief pharmacist within our acute will be very pleased, because he's very keen on that support as well. So there are different innovative ideas. It started off as a little thought, and that thought, couple of years on, has come into fruition. So I'm really glad to say that this is an innovation or an innovative idea. Tammy,
Thank you so much. Thank you so much. Thank you. So I think the key thing here is that innovation is not about the big stuff. The small stuff also counts. And when it comes to patient center care for me, collaboration, I'll do the collaboration first. Collaboration also can be you're collaborating with a team. So and that might be because they've raised an issue with you, and you're thinking, wow, and to be honest, they're looking at you to do something about it. So for instance, I had a dietitian raise an issue with me, and the issue was every patient that comes out of hospital, they put them on supplement drink. For the people that know 40C, 40 juice, and all these other drinks, and they're not being assessed. And we find out that the problem with that is that I can send them on with the drink, but the GP is not going to, the GP in the community have been told not to continue that drink unless a patient has been assessed by a dietitian to need the drink. So one of the things, and we're having problem in which patients go into the community and then they go, oh, but I was having it when I was there and they didn't let me have any more. And they're coming back to me expecting me to give them this supplementary drink. And I thought, okay, we need to do some work here. So I reached out to the dietitian team and I said, first of all, you know what, the first thing we're going to do is every patient that comes onto the ward, we need you to come and assess them whether they need this drink or not. And if they need the drink, we'll continue. And then you let us know if you want them to go home on it. And you must write to the GP, because the GP is not going to continue it otherwise unless you tell them that the patient actually needs it. The other thing we did was actually, while we're there, why don't we work on the formulary? Because the other problem that occurred was the fact that the formulary that is in the hospital is different from the formulary in the community. And so the patient come out of the community, we give them what they were giving them in hospital, as in the previous hospital they came from. And then when they go into the community, the GP was like, even if I got a letter from the dietitian, I still can't give the one you're asking me to give because it's not formulary in the community. So we actually worked on some form of formulary that is in line with the community. So when a patient come onto my setting, whatever they're doing in the acute hospital, we change them over to what they should be doing in the community. So if any reason they need to go home, we know they're going on with what we know the GP is quite happy to prescribe. And that actually helps us. The other thing is that as a result of getting the dietitian on board to review the patient, we actually are able to stop a whole lot of those supplements, even on week 1 of them being on the ward. And some of these patients, they stay on the ward till week 6. So you can imagine the cost savings, obviously. But more than that is the fact that we're not sending the patient home on what they don't need. And also they are assessing them properly to
Absolutely.
say actually, because sometimes they don't even like the drink and you're almost forcing them. So for me, that's an innovation, and like I said, that collaboration has to happen, and it's important that it happens with the team. And those are things that you can pick on, and it's easier when you have another team on board, because then you're not doing it on your own. And especially if it's an area of their specialty, they're more likely to push it for you, and you're not actually using a lot of energy. So very important.
I've
I
got
will
better
hold,
here.
yeah, I will hold and let Bet speak. Bear with me. It should be moving. Yeah,
Hi,
that's it. Please go ahead, Better.
Okay. Thank you guys so much for this session. It's been quite informative. I just wanted to ask, in terms of like training or upskilling for the role, what is required?
Can I push back the question and so I can get better clarification, please, Better? When you mean for the role, is it a role as a health as a head of medicines management or what?
For medicines management in community, like the community services that you're providing. So what do you need to upskill yourself to be able to,
Okay.
I mean, did you need to upskill to provide the service? That's the question.
I think that the first thing is, as a pharmacist, there are transferable skills that we all have, and is being able to own on those transferable skills. Of course, the experience does also matter, and for me, as someone that is probably speaking today, is being able to look at what I could offer within community health. Know fully well that I've got experience in community pharmacy, in hospital pharmacy, in emergency prisons as previously, is thinking about what am I bringing on the plate. Of course, there are other skills that you are able to sort of learn, and it depends on your service. So when I think about it, depending on my service needs, I needed to learn more about palliative care. I needed to understand more about dentistry, for example, because we do have another service that offers the dentistry dental care. I needed to, it's just looking at the different needs that you've got there. But the basic knowledge in pharmacy, you already have that. It's just being able to transpose that information from, whatever setting you're currently in, and be able to, I think it's the transferable skills, and then building up on that depending on what services you offer. Tammy?
I think I agree completely with you. I would say, actually, when I came into community health service, I have no clue about community health service. I was coming from hospital. I've been an hospital pharmacist for 8 years. I did a bit of locum here and there in community, but in fact, when I went for the interview, I came out of the interview and I thought, what did you apply for again? But obviously, I was able to, I guess I started slow. So I started from a geriatric kind of side. So we were only looking after older people. And within that community health service. So most of our patients are frail older people. And so I started from that, and the skills that I was able to transfer it to where I am now, where we look after children as well as older people. And so, like Jenkyo said, you have the basic skill. However, I will say, especially if you are expected to be clinical, you need to obviously have your clinical skill to be sound.
Yeah.
Because there are times in which your pharmacist will disappear, i.e., they go another job and they move on, and you will have to step into their role as the ward pharmacist until you are able to recruit another. And so you are expected to be able to fill that role, as well as do your strategic stuff. So, and the strategic stuff, it comes with time. And there are things when I step into the role, there are things I had to learn. I had to go to YouTube to learn about how to actually facilitate a meeting, how to chair a meeting. Not because I didn't do a bit of that in my previous role, but I'm doing it on a larger scale. So I need to know. And there are times you will get it wrong. You will go to a meeting, you will say things, and the way people look at you, you thought, I shouldn't have said that. And you know not to say that next time. So community health service for me is been a learning. There are skills I brought in, but there are skills I've learned that I don't think I would have learned it anywhere else, because you have to be able to be almost creative and be inclusive, because remember, most of the community health service, they are nurse led, they're not actually doctor led. So it's important to be able to have that collaboration and to be able to keep asking questions so that you know what services are out there, how you can support them. One of the things I did when I actually came into my role as the head of medicine management, I had a meeting with every single service manager that I could find at the time, especially because it's COVID. I actually came into my job during COVID in 2020, but I made it a point of duty to book a team meeting with every single team leader and team manager, service manager. And my question to them is, what are the medicine issues that has been troubling you? And what are your ideas? And how do you think I can help? That is one question I asked all of them. So by the time I finished that whole scenario, I have an idea, because a picture was painted for me right across the organization. NMP was one of those problems, different things that they painted for me. So I have an idea of what the problem were. So I know what skill I need to go and get to be able to fulfill that issue. And it's also not to burn bridges. So one of the things that also helped me is that I was able to go back to my manager, and he was able to support me. And I also had a coach. I had a coach and a mentor. And that really helped me, because I had a space. Because one of the things about being the head of medicine managers is that you are actually the chief pharmacist, which means there's no other pharmacist above you. So you can't go to another pharmacist within the organization. So you have to go out. And it's important to have that network already, so that you have people you can go to, and you are able to actually get wisdom from them, because they've been in that business for a while. I hope I'm not too long. I hope I answered your question.
You did. Thank you. Thank you.
Fabulous. I think we're almost drawing to a close. There is a lot, I'm sure, we have been able to take on from the word innovation in healthcare, and also to make us realize that, no small idea can be discounted. Just those little minute changes or little minute issues or tingling ideas you might have might impact on might have a greater impact. So I want to encourage you, wherever walks you're in healthcare or non-healthcare, to always think about it, that if you have an idea, go for it, run with it, don't discount it. But innovation in community health services is essential for addressing evolving healthcare landscape, meeting the needs of our patients. And I'm sure Tammy would echo this with me, that as the head of medicines management in the community health services, we are committed to driving a forward thinking in terms of enhancing medication practices, standards, making sure our services or our staff out there are adhering to medication standards, and also working in line with other healthcare partners out in the community or in the patch. It's important that we look about promoting patient-centered care, and ultimately what we're trying to drive is to improve a better patient outcome in the community. So thinking about population health. So it's not just you thinking about it, that we're working in silo, we're working all together. So the collaborative working, it is key I know if anything you could pick up today is those ideas are not too small. Some ideas are big, some ideas are small, but every idea is valuable. Thinking about the collaborative working, we talked about, embracing technology, data analytics, fostering collaboration, prioritizing on patient engagement. And we can just continue thinking about innovation. I want to say, a big thank you to all of you, because I believe that you and I have something inside of us. We have that idea inside of us to, drive change out there. So please don't keep it hiding. Let's bring it out there. And, whatever it is, think about who else can, work with you, other stakeholders that you can bring in to make it work. Never discount your idea. I think, Temi, are we hitting the right point here?
Yeah, we definitely are. And when you were talking, is about those innovation, and I think sometimes innovation is about mindset, and it's about changing our mindset, because yes, innovation is hard work. Innovation takes time. Innovation, you have to invest time, but when you invest time, you are able to actually get the results out. And I think one of the things I'm really passionate about, especially in the world of pharmacy, is, and I'm sure it's the same in some other organization, we do a whole lot of work, but we don't showcase our work. So we're talking about innovation. I'm sure some people, they've done innovation within their organization and they've not really showcased what they've done. And when you've done an innovative stuff, for instance, for people that are in the world of pharmacy, RPS allows you to publish an abstract of what you've done. Why don't you publish what you've done and let people know what you're doing? And in some other setting, find out. There should be an outlet where you can publish an abstract of what you've done. Or actually, if you think what you've done is not, a big deal, why don't you go to conferences? One of the things I do, I go to conferences and you see what some people bring to the conferences and you're thinking, I did better than that, but nobody gets to know what you've done. So it's important that we actually let people know what we've done. So change, that mindset, and it takes time. And you will need funding. One of the example I was going to give is for the people that know about discharge medicine service, and it's about spotting the opportunity. Discharge medicine service were only rolled out to the acute trust. But then I heard about it and I was like, why can I not have it? Everybody's getting £6,000. Why can I not get £6,000? So I went to the ICB. I said, I want the £6,000. They said, no, it's not for you. It's for NHS Trust only. I said, okay. So I said, so the next time they had a meeting, I brought a reason. I went to go and look at my patients and I give them a cohort of patients of why I think I need the money. So the next time NHS gave another £6,000, everybody received their first £6,000. So I was like, well, the next £6,000, you guys don't really need it. Or even if you need it, you don't need everything. So can I have some of these £5,000? And I gave them data why I believe I need the £5,000. And they gave me 4,500. And I was able to roll out discharge medicine service for my organization. And as it stands at the moment, until I hear otherwise, we are the only organization delivering discharge medicine service in the whole of England. So it's about, sometimes you look like you're poking your nose here and you're asking questions everywhere. Poke your nose and ask the question. And, if the money is going, there's no reason why asking questions. Why not community health service? Why not my service? Why not what I'm doing? And I think when we're talking about innovation, I know we're talking about from the point of pharmacy, but it applies to any field you have. It's about spotting those opportunities and taking hold of those opportunities. And don't let anybody tell you no, because that is so important. And I want to say a big thank you to everyone.
Maria wants to speak.
Yes. Sorry. Apologize. See, I'm talking too much.
Oh, no worries. Thank you. I just wanted to add about, because you were saying about publishing, your innovation and ideas that you've got with the RPS, but we've also got an NHS Futures platform within Kent and Medway for pharmacy professionals. So if you are doing something within your organisation in the world of pharmacy in Kent and Medway, I'd love to be able to, write an article about what you're doing, or you're welcome to put any posters on there, or publish anything that you would like to share with other pharmacy colleagues within Kent and Medway onto that platform. And that's a really great way that you can share your work locally. So if you don't feel quite brave enough to go into a national conference or with the RPS, you're more than welcome to join that network and share projects and ideas on there. So if anyone's interested in joining that network, you can just pop me a message and I'll send you an invite to join.
Fabulous. Thank you, Maria. I think that gives us the opportunity to tap into those resources as well, isn't it?
Definitely, yes.
Fabulous. Okay. I think we will be drawing our meeting tonight to a close.
Yes, definitely.
Also to remind us that we also meet next month. Usually second Tuesdays of every month will be when we would have our sessions together, talking about, healthcare, community health services. And by all means, if you have ideas on what you would like us to talk about, we will always welcome that. So you could post it in the comment section, it will be lovely to hear from you. But once again, thank you all. And I say all of you, thank you so much for waiting behind. Thank you so much for listening. And thank you for being a great audience. And see you next month.
Thank you, everyone. Thank you. And don't forget, innovation is not just about having a single idea, it's also creating an environment where your ideas can grow. So I hope you are able to take something away. And we hope to see you. Spread the word. We will love more people because I think, innovation cuts across any organization you work in. So do spread the word. And yeah, like Jenko said, if you have any topic that you want us to discuss around, obviously, medicine, please do drop it in the chat or in the comment section, and then we'll pick that up. Thank you so much.
Thank you.
Thank you. Have a good evening.
Bye, everyone.
We say good night. Bye.
Oh, Bola wanted to speak.
Oh dear,
Bola.
sorry. Oops.
How's everyone is going?
Hold on, sorry.
Oh, she's gone now.
Okay. I did try to put that. Oh, she's back. Oh, please go ahead. Oh. Hello. Oh, she's gone. I think
fine. I guess
reception issues.
Information I think people should just post into the comments.
If you can post any ideas, any information that you want to share, please do put it in the chat. Thank you so much.
Thank you so much, Lydia, Wale, Mo, Akbawe, long time, Ernest. Thank you so much. Have a good evening. And
good evening, everyone. Good evening. Bye.
Bye.
Bye.